what is your reaction to having to think, you know, my patient may need something and I don't know if I can tell them the best thing for them to do? How do you even process that?
It's incredibly difficult, Ashley. This is going to fundamentally change how medicine is practiced in the
Mm,
US. Prior to this ruling, the patient was always at the center of every clinical decision that any doctor, medical student, or nurse makes. It is always, whatever we do, it is in the best interest of the patient.
mhm,
Now, with this ruling, the law is at the center of every clinical decision that we will be making moving
mhm,
forward, depending on the state that you live in. This is not how medicine should be practiced here in the US. We have something in our clinical realm called the standard of care, which
mhm.
is a set of criteria or an algorithm for whatever diagnosis or condition the patient has. We follow the standard of care. Anything less than that is not reasonable. And unfortunately, in states that ban abortions, these patients are not going to get the standard of care, which means that there will be poor health outcomes and an increase in maternal mortality.
Are also, you know, other forms of contraception. You have birth control, IUDs, emergency contraceptives like the Plan B pill.
And the key here is that the definition of what pregnancy means because of the SCOTUS ruling is different than what a definition is in medical terms. In medical
Mm,
terms, when we think of a pregnancy, we think about after implantation. In this ruling, pregnancy is defined by the moment after conception. Those are different things. For
right.
things like Plan B, emergency contraception, the oral tablets, these are all that is that gray zone that people are really discussing, constitutional scholars, obstetricians, and others in ethics.